The topic is nose and rhinitidis. The objectives for this lecture is at the end of the session, the student should be able to describe the clinical history and physical examination of the nose and paranasal sinuses. Should be able to know the common rhinologic tests, imaging of the nose and the paranasal sinuses, and common causes of rhinitis.
In diagnosing a patient, a good clinical history is the first step. Ask for nasal obstruction, discharge, allergy, or headaches.
Headaches. Next would be the physical exam, inspection of the nose, palpation, including the paranasal sinuses, doing anterior and posterior rhinoscopy, and if necessary, nasal endoscopy. You can view here the short review of the nose. The ostomeatal unit is found on the lateral nasal wall. The paranasal sinuses open into the nasal cavity except the sphenoid sinus. The uncinate process, the hiatus semilunaris, frontal recess, ethmoid bulla, ethmoid infundibulum, and the maxillary sinus ostium. It is bounded medially by the middle turbinate and laterally by the lamina papyracea. Its clinical significance in rhinogenic inflammation of the paranasal sinuses. Special rhinologic tests include active anterior rhinometry, acoustic rhinometry, allergy testing such as skin tests, serologic tests, nasal provocation tests, and olfactory testing. Active anterior rhinomanometry is the assessment of nasal patency. It measures and graphically records the difference in pressure from the nares to the nasopharynx and the respiratory air volume per unit time. One nostril is occluded while the nasal air stream is measured on the opposite side, and vice versa. It cannot be performed when one nasal cavity is completely obstructed. Acoustic rhinometry is based on the principle of acoustic reflection. It measures static parameter, determine intranasal cross-sections at various sites, then averaged together. Used in examination of pediatric patient. Here's a picture of an acoustic rhinometry. Here is a case of a 25-year-old male consulted due to nasal obstruction. 5 years prior to consult, patient has been having on and off nasal obstruction, usually temporarily relieved by nasal decongestants. No consult was done until recently. On physical exam, there was pale boggy turbinates on anterior rhinoscopy with watery nasal discharge. No mass on posterior rhinoscopy. No palpable neck nodes. What would be the differential diagnosis for this? So these are the differential diagnoses of nasal airway obstruction. Acute and chronic rhinitis, example, allergy, atrophic rhinitis, sinusitis, deviated septum. It could either be congenital or acquired. So elicit for history of trauma, nasal pyramid fracture, septal perforation, nasal polyps, cephalocele, adenoids, tumors of the nose, paranasal sinuses, and nasopharynx, foreign bodies, especially in small children, drugs, adverse effects, oral contraceptives, antihypertensive agents. Here is a short clip on nasal endoscopy. Imaging of the nose and paranasal sinuses could either be a conventional radiograph, such as the Waters or the Caldwell view. But nowadays, we usually ask for CT scan or the computed tomography. Rarely, we request for an MRI or a magnetic resonance imaging. It would be a case-to-case basis. So here is a picture of a waters view and a Caldwell Lock view. This is a coronal view CT scan showing the frontal sinus, the maxillary sinus, and the ethmoid sinus. This is a coronal cut CT scan as well, showing the sphenoid sinus on the left and maxillary sinus on the right image, as well as the ethmoid sinuses. Part of the frontal sinus is also viewed in this CT scan. This is an axial cut CT scan showing the maxillary sinus and the nasopharyngeal recess on the left image. On the right image, the ethmoid sinuses, the maxillary, and the nasopharyngeal recess can also be viewed. An axial CT scan cut showing the ethmoid sinuses on the left and the nasopharyngeal recess, while the right image shows the frontal sinus. This is an MRI showing a coronal, an axial, and a sagittal view of the head. Diseases of the nose, paranasal sinuses. Congenital anomalies like choanal atresia occurs in 1 in 5,000 to 1 in 10,000 births. There are more unilateral than the bilateral cases, as well as the more cases of bony atresia in 90% than the membranous one. It could also be associated with various anomalies like Charge syndrome. Treatment is done during the first week of life if it is bilateral choanal atresia. Another congenital problem is the frontobasal dysraphias. It occurs in 1 in 20,000 to 1 in 40,000 births. Examples of frontobasal dysraphias are the dorsal nasal fistulas, the dermoids, frontonasal extracerebral gliomas, and cephaloceles. It happens if there are any history of teratogenic agents during the second or third week of embryonic development, when the neural tube is forming from the neural plate. Fourth week, when the cerebral ventricles and central canal are forming and the central nervous system is separating from the epidermis and migrating to a deeper level. Diagnosis is done by CT scan and the treatment is surgical excision. Nasal deformities like septal deviation is diagnosed using rhinomanometry and olfactory testing. Septal deviation is treated surgically, called the septoplasty. Nose bleeding or epistaxis. This is the table of local causes of epistaxis. Classification examples like change in nasal septum, perforation. It could either be traumatic or iatrogenic, inflammatory, spurs or ridges, mucosal or vascular injury, foreign bodies, rhinoliths, trauma, including nose picking, happens during, usually occurs in children, the nose picking trauma. Allergy, acute rhinitis, traumatic, aneurysm of the internal carotid artery, which is very rare, neoplasia, benign and malignant of the nose, paranasal sinuses, and nasopharynx, and idiopathic. Severe bleeding or epistaxis could happen in a juvenile nasoangiofibroma. Although it is a benign tumor of the posterior part of the nasal cavity to the nasopharynx, it can cause blood loss. It is rare and it happens or it occurs in the pre-pubertal and adolescent males aged 7 to 11 years old. Systemic causes of epistaxis include vascular and circulatory diseases, atherosclerosis, arterial hypertension. It can also happen in infectious diseases like influenza, measles, typhus. Endocrine changes or disease like pheochromocytoma, pregnancy, and diabetes mellitus, or hemorrhagic diathesis, such as the following listed. Inflammation of the external nose and nasal cavities include acute rhinitis, allergic rhinitis, and non-allergic rhinitis. Nasal polyposis is a benign tumor of the nasal cavity. There are numerous theories on the formation of nasal polyps intranasally. Cavernous sinus thrombosis is a rare, life-threatening disorder that can complicate facial infection, sinusitis, orbital cellulitis, pharyngitis, or otitis, or following traumatic injury during surgery, especially in the setting of a thrombophilic disorder. This is a clinical picture of a patient with cavernous sinus thrombosis. Thank you very much for your kind attention.